What are some of the things that you've figured out that type 1 diabetics really need to focus on when they're dealing with their diet and their diabetes?
I think education is very important. So education for anything that you do. I guess irrespective of the whole low carb thing, when I have people with type 1 diabetes come to see me and practice, they know, well, this is a generalization, but a lot of them know very, very little about, what HbA1c is, the health of their pancreas, what's even type 1 diabetes, what does it mean, why are they working so hard to keep their blood sugars under control. So I think it's easy to sort of be in this kind of community. Well, I guess the low carb community, everyone's very invested in their health, but when you look at people that aren't, aware of these things and they're in a different sort of community or whatever it may be, or they're just in the standard healthcare system, they don't actually know a lot about the fundamentals of their condition. So teaching and educating people about the fundamentals of their condition and why they would sort of choose particular dietary strategies to help manage their condition is super important. Some of the studies looking at type 1 and even some of the studies looking at type 2 or even obesity and low carbohydrate nutrition, if they just simply say, oh, we put participants on a low-carb diet and kind of just left them for 6 months, that's not going to do anywhere near as well as another study that has regular educational support sessions, maybe every week or every month, and so on. So it's very easy to sort of forget that the methodology behind these studies is super important, and how the low-carbohydrate diet or any diet is provided to these patients is very important. It's crucial for type 1 diabetes. And then I guess as well, in terms of specific strategies, I think consistency is very important for someone with type 1 diabetes. So you can have different ranges of carbohydrate intake. It appears in the literature, some studies were reducing carbs right down to 20 grams per day. Some studies were reducing carbs to 150 grams per day, and they're still both seeing benefit. But I think, the consistency in spreading that carbohydrate out across the day is important, irrespective of the carbohydrate prescription.
That was one of the things that always surprised me when they did that A to Z diet study, was that like the Atkins diet did really well and it did the best out of all of them. But one of the things that always gets lost is that any diet did really well if they actually read the book and followed it closely. And you could be one of these other diets and do it. So that level of education where you're not just kind of winging it, or just trying to figure it out on your own, seems to play a huge difference in how successful someone is on any particular diet.
Well, I think that there's a lot of, like you said, there's a lot of non-education going on, and that's always bothered me. I saw a commercial on TV one time, and I had to tweet about it, and I never do that because it was a commercial for some kind of medicine for type 2 diabetes, and this guy's walking around talking to people who have it, and he said, did you know that you're more at risk for heart disease? And they're like, no. And I'm like, are you kidding me? Who is your doctor that you don't know? I mean, I know it's a commercial, but I mean, if they don't really know all these things, it's just it's a real lack of education. And if they're not, if I'm not given the reasons behind things, I mean, that's really important to me. If I'm not given the reason behind things, then it doesn't make sense to me in a day-to-day moving forward, doing everything that I have to do. If I've got that knowledge behind it, knowing why something is happening, then I can work through, what to do. But yeah, I think it's really bad about the education. It's just not there.
Yeah. Well, it's funny you say that, because I always say to people, once you know something, you can't unknow it. And then it becomes the decision person. So sometimes I like to just talk to people about, you know, the fundamentals of biochemistry, how I got into all of this, what insulin does in the body, the effect of carbohydrate on glucose levels and on insulin levels and so on and so forth. And then that person just goes, oh, well, I need to reduce my carbohydrate. So I haven't even said anything. They've learned about the science, and we've used their blood test to sort of say, okay, well, this is where your health is at, this is where we need to go, and they put 2 and 2 together. And then they go ahead and make those informed decisions. And you know what, if somebody comes back and they say, oh, I had a piece of bread on the weekend or whatever, I go, okay, well, what did that bread do to your body? And they say, oh, okay, well, it released glucose into my blood and insulin went up. But you know what, it wasn't worth it. I don't want to do it again. And I go, okay, my job is done. I didn't have to say anything, because people can then go off and be independent and, you know, make their own food decisions, which is really key. You know, we don't want people having to message their dietitian and message their doctor every week going, can I have this, can I have that? Obviously, that support is required at the beginning, but then going through for the rest of your life, you want to have those tools to be able to, you know, make your own food choices, I guess.